I'm sure my colleagues already talked about this. The one of the famous one is the augmentation of labia majora by hyaluronic acid. Just case show you the hyaluronic acid. Some of these non-surgical procedures are really very good. Some make some improvement, and some of them really don't work at all. For example, this is hyaluronic acid augmentation. Again, this is a 56-year-old before and after. This is very interesting. I always put this slide. She's a 32-year-old after 2 childbirths. She came to me and she wants labiaplasty. As you can see, it's hanging down, so she said she wants surgical labiaplasty. And I've done labial augmentation by hyaluronic acid, and really she was surprised. Another one. Some cases, radiofrequency make them better by 1 session. Oh, this clean show, amazing. This is from 1 session. You can see here the perineum really improved markedly after 1 session. Again, not as much improvement, but better. Still not enough in radiofrequency. For example, here, what you don't going to do with a dog ear. This is surgical. And this one is really hypertrophy, extreme hypertrophy of labia minora. You can't really treat it. And I've done the radiofrequency, that's the best I can get. And asymmetrical. What are you going to do with that? Sometimes it doesn't work at all, like this case, as if she didn't have anything. So the conclusion, we can always, we have to be careful about the selection of the case and taking informed consent, and the technique, we should be careful because there are 8 techniques, at least 8 techniques of labiaplasty. The famous one is wedge with epithelialization, which is sometimes we can get into the rectal tissue at the base. So you have to inform the lady that there might be, the sensation will be less. Also, there's a lot of complications, huge big cases of hemorrhage and bleeding.